In this session, we are going to see principles of disease surveillance. So in the coming slides, we will see what is surveillance, basically the definition and the meaning of the surveillance, and its key elements of the surveillance, and the flow from beginning to end, how the flow runs in the surveillance system, and the basic types of surveillance like active surveillance, passive surveillance, and syndromic surveillance. And finally, what is the use of this surveillance system or surveillance data collecting from a primary health center or from the community, and how this is going to be used for decision makings. So before entering into the definition of surveillance, so we will see the commonest understanding about our people. So most of us are already working in the surveillance system, or we know the what is surveillance system, but many people they misunderstood. They're thinking they're just collecting data from a sub center or primary health centers or community centers. The data goes to district level, and the district level people they send data to the state level, and the state level they send to the collected data into Ministry of Health and Family Welfare. But is this surveillance system of how it runs? No. So in the coming slide, we will see what is exact of a surveillance system. So the definition of surveillance system mentioned that it's a systematic process and the collection of data, transmission of collected data, analysis of data, and generating the feedback report. And based on our data and feedback report, we make the decisions. So the definition itself is that systematic data collection, transmission, analysis, and decision making. So what is systematic? The systematic is ongoing routine process. Each word it has a separate meaning in the definition. So the systematic word mentioned that is ongoing and a routine process of data collection. So what kind of data we are collecting? So we are collecting the predefined cases data and counted consistently. We are not going to collect all the data from the community or hospitals, but we have the list of cases we already mentioned. We listed some what are the cases we need or we need to collect from the community or hospital settings. So that data only we are going to collect every day. So the next word is transmission. So that data, once we collect the data, we need to transmit this data regularly. So once transmitted the collected data, the next step is analysis. Why we need to do analysis? The analysis helps to convert the raw data into the information. Just numbers won't give much information, so we need to convert that number, just raw data, into information, meaningful information, to generate, to useful for decision making. Here, instead of just number of counts, say example like 10 cases from district A or 10 male cases, just we can convert this is a rates, infant mortality rate or maternal mortality rate or death rate. We just convert the data into the information or rates. So once we analyzed the data, the next step is feedback. So the feedback, it has the structured informations and uses for reporting. So based on this, we make the decisions. So the definition itself, it has the word, each word it has the meaning. Like systematic, what is a systematic? Is a routine process, and we are collecting the data, predefined cases data. The collect data transmitting, how we are going to transmit, we will see one by one. Then once we transmitted this data, the next step is analyzing this data. Based on the analysis, we convert the raw data into information. Based on that our information, we make decisions. So we now see that what is the definition of surveillance. Now next step is elements of surveillance. So basically surveillance is a cycle process. So it has two major things. One is healthcare system and another one is public health authority. From healthcare system, we collect the events data. We are not collecting the just cases data, we call it events. We will see what is events. Just we collect the events data. That events data transmitted to a public health authority. That data will be converted as information. That information again sent to healthcare system as a feedback for decision making and actions. Again the process starts. So from events, which is from maybe primary health centers or health facilities or hospitals, we are reporting as a data to the public health authority, to district level or state level. They do analysis and generate the reports, what is what. Then from that information disseminated to again healthcare system for decision makings. Again, we are collecting the events. So it's just one cycle process, and it happens between healthcare system and the public health authority. You can see there's a routine process. So what is events? So events, we are not just we are collecting the data of cases, we are collecting the data of events. It may be the diseases, it may be malaria, it's maybe typhoid, it may be HIV. We're just collecting the disease data, that also called event. Another one is syndromic data. Instead of just predefined disease data, we call it syndromic data also. Then we also collect a behavioral pattern of the some diseases, maybe example HIV, behavioral patterns of the community for particular disease. We collect the behavioral data also. And we collect the environmental data also. What is the environment? Maybe air pollution, water quality, and the soil degradation. We collect the environmental related data also. So here in the surveillance system, we are not only collecting the disease, we also collect the diseases, syndromes, behaviors, and environment. These all collectively called as events. So that's what we call event. So if we think about, we are collecting that disease data, say vector-borne disease, we are collecting malaria data. Water-borne disease, we are collecting diarrhea, or cholera, typhoid. Maybe the respiratory disease, we are collecting tuberculosis data, measles, polio, and some unusual syndromes also. So if we think about the diseases, these are diseases we are collecting under IDSP programs. So syndrome. So we not only collecting in the public health surveillance, not only collecting disease also, we are collecting syndromic data also. Like syndromic surveillance is just a less specific criteria. It's not like a very definition of each disease and all. Just is a very less specific criteria. Uh, Occurrence of a disease not based on specific clinical laboratory diagnostic criteria. These surveillance based on just a signs and symptoms like a fever. It is not a disease. We can just collect the fever surveillance. We collect based on signs and symptoms. Chief complaints. This is called syndromic surveillance. So basically, the syndromic surveillance objective is it provides earlier indication of unusual increase on illness, and it's used to facilitate early interventions, and it's very less specific and more sensitive, like acute flaccid paralysis for polio. Then behavior surveillance system. Take example National Integrated Biological and Behavioral Surveillance. It's used to estimate the change in HIV-related risk behaviors or HIV prevalence among key risk groups. We can make a surveillance report from the key in specific key risk groups. In this surveillance, we collecting the behavioral changes of the HIV population that may be the targeted from peoples like if female sex workers or transgenders and drug users. Just we collect that any behavioral changes from these people. We can take another disease also, maybe TB risk groups, COVID groups. We can take any behavioral related disease and we can collect the data. And environment. And in data samples collected from air and water and soil, etc., called environmental surveillance. And also in the health concern, it's used to monitoring the endemic diseases like detecting pathogens in sewage and polio. And polio also, we are collecting the samples from sewages. So basically, we collect the environmental samples. It's maybe air, water, and soils. As all of you know that in the polio also, and that many people to eradicate polio in the globe level. So they collect the samples from sewages. They detect the pathogens. This is called environmental surveillance. Just the pictures is that where they are collecting and that samples. Again, from a number of cases, pathogens from each wards. So in the previous slides, we seen that what is surveillance. Is a systematic collection, transmission, analysis, and feedback for decision makings. And what kind of events data we are collecting. It may be diseases, it may be syndromes, or it may be the behavior patterns of the community or any specific diseases, and any data related to environmental diseases. The next thing is that we need to define the cases. What is case? If it is a diseases, we need to define what is case, what is malaria, what is a typhoid. Then only we can collect clearly from the community or hospitals. So once we know what we are going to collect, then only we can easily collect it. So examples of malaria. One person maybe say that as a general community persons, they say that if someone has a fever, they can say that's a malaria. Healthcare worker also say that it's a malaria, and some other symptoms they say that. If it is a doctor, he will give more very clear understandings of maybe fever with the splenomegaly, megaly, and a laboratory person say that a fever with the positive slide. So the based on the designation or the experience, the definition it may varies. So we need to give the clear-cut definition of each diseases, then only we can collect in the surveillance system. The system just needs to be very consistent every day. So it's not about the person, so we need to make clear-cut definition of each diseases or syndromes or behavior patterns or environmental issues. Then only we can collect data of any diseases or events. So once we collect the data, once we define the data, then we need to collect the data. From where we are collecting the data? It may be the disease reporting system, it may be the vital statistics. We can collect the data from the surveys. It may be community based surveys or hospital based surveillance or laboratory based survey. These are the data sources of any surveillance system. Who are the population for surveillance? It may be general population, sentinel populations, or special populations. So general populations. So we take the example of Tamil Nadu or India. So the whole country or whole state, or take any districts of Tamil Nadu, and maybe it's Chennai or Tiruvallur or Kanchipuram, any district. The whole population of any defined area is called general population. We can collect one whole state population. If it is a Odisha, we are going to collect whole state population. That's called a general population. Sentinel sites basically it's a healthcare facilities, is a medical colleges or super specialty hospitals or district hospitals. We make surveillance system in the sentinel sites. Maybe if you are working on the pediatric diseases or meningitis, if you we can establish a surveillance system in the hospitals, those who are treating the diseases. So we can come to know that the prevalence or the pathogens or risk factors of that disease. The sentinel sites is a facility based surveillance system. The another one is the another populations, maybe the specific communities, maybe the HIV groups. So we'll see that. So the general population surveillance system tries to capture in the whole population. It used to estimate the denominators. So many analysis, we need the denominators, then only we can count the proportion or rates. So the census data or whole general population data is used to estimate the population denominators and calculate rates. For example, a national disease reporting system is one of the collecting mechanism from community or whole population. The Sentinel surveillance system, as we discussed in the previous slides, is collecting data from the selected spots. The spots, the health facilities, and we call it is the Sentinel sites. So here is difficult to estimate the denominator because it's we are not collecting the whole population. It's collecting from hospitals or facilities. Example: HIV Sentinel surveillance. So the special populations, we are collecting data from the very specific population. That specific population may be diseases or cohorts, any communities. So example, nosocomial infections from the hospital-based inpatients. If you think about that, so one special population, we can collect the data from the patients. Maybe the persons from the prisons, we can collect. And we can collect the data from Olympic Games festivals. These are the very specific populations. So we can establish the surveillance system and we can collect and we can generate. the reports. So the next one is type of surveillance. Primarily, there are two kind of surveillance system in everywhere, maybe in the globe or India also. One is active surveillance system and another one is passive surveillance system. The passive surveillance system just a routine reporting through normal channels, and active is the healthcare workers or staffs actively seeking the cases in the population or healthcare facilities. So example, the passive surveillance. Most of the surveillance systems are passive surveillance systems. Like healthcare facilities or providers report cases as they present in healthcare facilities. There, we no need to make specific efforts to collect this data. And this surveillance system already integrated with ethical delivery system. Example, surveillance of measles in India. So like IDSP, we are routinely collecting the data. The active surveillance is a case patients to come to healthcare facilities. These healthcare facilities, they will report the cases. And then active cases, the healthcare workers or healthcare staffs, they go to the community, they actively detect the cases. Maybe they go to each and every houses during the outbreak investigation. Take example of COVID. What many governments initial times they did, they go to door by door survey. They ask the community, the household members, if they are facing, if they are having any issues like symptoms like cold, cough, or fever, and based on that symptoms, and they do the test and detect the cases. So this kind of active surveillance during the outbreaks or any potential disease, the healthcare workers go in the community or households to detect the cases. This is called active surveillance. Like SARS, COVID, we do the active surveillance. But here we need, it's a more cost effective and we need a lot of human resources than passive surveillance, because passive surveillance already integrated with the routine surveillance and all the facilities with the reports. They routinely report the cases, predefined cases, but active surveillance is during the outbreak or potential disease times. So we collected all the events. So we know the what is a surveillance system. It's a systematic data collection. So we collected the data. With the what kind of data collected? We collected event data. It may be diseases, it may be syndromes, it may be the behavior patterns, it may be the environment data. We collected all kind of data. We see the types of surveillance. It may be the active surveillance or passive surveillance system, and the data sources may be the surveys, maybe vital statistics. We collect the data from the we may collect the data from the general population or very specific population, or maybe the data from health facilities like sentinel sites. So once we collected all this data, then we are reporting to the public health authority. So there are two types of reporting methods. We may send as individual case reports, or we can send aggregated cases reports. The individual case, we are sending details of the each and every cases, and the aggregated, we are not sending the details of all the cases, but we are sending the number of cases, the selected characteristics. We see that individual reporting, we send the time, place, and the person's data. We call it line listing. Hope all of you know that we are collecting the line listing of the patients, and many of you already experienced in the during COVID times. We just, if it is active surveillance, we go to the households or community, we actively get the information of if the person suffering from any symptoms like what is a name, gender, age, occupation, education. We collect all the report, all the details of that individual person who is suffering from some COVID-19 related symptoms. So that list we call is line listing. So if it is an individual report, that is called a line listing, and it allows to make all the cross tabulations or further analysis. This is like line listing. Here we have the serial ID number, the onset of symptoms, location of that person, village A, B, C, or age of that person, gender of that person, whether vaccinated or not. So we have all the details of the person here. Is take the example of one ID number one. That person is to age from village A. It's a male and vaccinated. That person is vaccinated. is called line list. So aggregated data reporting, the number of cases are reported according to common characteristics. Again, it's a time, place, person, but this is not the line listing data. This is aggregated data. We are not sending the line list. We are sending here tables. Here we can't do much analysis. We cannot make cross tabulations also. So the reporting method. So we collected the individual patient's data, or it may be their line list or tables. How we are going to report to the public health authority. So we have three methods. It's maybe paper based. So all of you know that so far we are using the papers only, P form, L form in the IDSP format. So we maybe daily or weekly reports. So we just collect the data from the facilities. We send the line list. We send the consolidated report to the community district headquarters. It may be telephone or the next method is telephone or fax if it is emergency, and we can telephone data collection. Then now currently most of us were shifting to electronic based reporting methods, maybe email or applications. We will see one by one. In the telephone or voicemail central reporting unit, maybe it's very fast because of the data collection is very immediate. A paper regularly we are sending to the higher levels. Most of the surveillance as of now we're using paper, but slowly we are converting into electronic based surveillance systems, because most of the PSCs are community health centers or district hospitals and either computers with human resources. And the next one is reporting frequency. So we're collecting the individual or aggregated data. Now we know the how to report that it's maybe paper based or electronic based or telephonic based. So what is the frequency of that report? It's maybe the immediate, or it may be the weekly report or monthly report or annual report. So it's immediate means like example COVID cases or any potential outbreaks we can report immediately. Most of the IDSP data are weekly basis. If it is a very chronic disease, we can send annual report also. So once we reported the events data into the public health authority, that data we need to analyze and make information from this data. So what is data analysis? We can just count. What is counting? Just individual or aggregated data, or just a compiler. Like take example of malaria. How many malaria cases are from district A, or how many male malaria cases? Just we are counting how many cases from all the state, how many cases from the district, how many cases from one block. So just we can count it, and we can divide. Just we can compile cases are divided in the population denominators, male, female. We can divide rate, infant mortality rate. We can just divide by the group of the population, and we can compare with the another groups. And we can compare with another groups or another region also. Maybe district A or B, or state A or B. We can compare with our data with another states. We can compare our data with another districts also. So we can compare the data, collected data, and we can do the advanced statistics also. It depends on the need. So once we collect the data, we need to, as we seen in the previous slides, just raw data won't help us to make decisions. So we need to do analysis. That analysis just maybe count. We can make it tables from whole this state, how many malaria cases from January to September, how many malaria cases. Just accounting. Then we can divide by districts. We can divide by genders, male and females. We can divide by ethnic groups. We can divide by religions, and we can compare with this group. So we need to do data analysis. Raw data just won't help us. So once we analyzed the data, we need to disseminate this information to again the healthcare systems. It may be the surveillance report. It may be the newsletters. The surveillance report indicates that where we are collecting the data, what kind of surveillance system we used, how many cases we are collected, the mortality data and morbidity data. We just make a surveillance whole report, and we can disseminate this information to the healthcare system people, or we can give us a newsletters every week newsletter or monthly newsletters. We can give the collected information into the newsletters, so we can see this whether the cases are increasing or decreasing, how effectively it is working. So once we collect the data, we need to generate the feedback mechanism. This may be from higher level to from state or country headquarters to the intermediate level, or from intermediate to lower level. Not only from highest level, we can analyze this at intermediate and to make feedback to the lower levels. And the feedback always contains the data analysis results, not just raw numbers. So why we need to give this surveillance report or summary? So these are mainly two purposes. So inform what is happening. So the whole year or every 6 months, every month or every week you are collecting the data from the community or from hospitals, from any special populations. So we need to inform what is happening and what is the burden of the disease, or any is there changes in the disease pattern. We need to inform. And second, this is motivate to inform. If you really that is working, we can see the downwards trend of any disease. Just so motivating them to they're really working. So we can send through mail or email or poster to health department website, so all the people they know. So far we know that a definition of surveillance, key elements of surveillance, types of surveillance. Now we will see the uses of surveillance. So we are collecting all the disease data, or syndromic data, or behaviors data, or environmental data. We are collecting from health systems, and the health authorities are analyzing the data, and they convert the data as informations. That information again disseminating to healthcare system or to motivate the healthcare workers. So just that surveillance is just not only the burden to assess the burden of disease. It has other many purposes. Surveillance data, we will see one by one what is what. Basically, as we discussed, it estimates the disease burden. We know that in the last year or last month, what is the malaria number of malaria cases in Tamil Nadu or Odisha. We know that disease burden. We can monitor the disease trends. We can take the last 10 years data or last year 12 months data. We can see that whether the trend is increasing or decreasing. So by using the surveillance data, we can see the burden of the disease, number of cases in the last year. We can see that in the last year 12 months whether increasing or decreasing. In which month the number of cases are increasing or decreasing. Maybe January increasing, July decreasing, again December increasing. We can see the trend of the disease. Then the next important purpose is geographic distribution of the diseases. Take the same example. So we can see that if it is the Odisha, Tamil Nadu, 30 districts, we can geographically we see that which district has more malaria cases or which place, or if it is India, which state has more number of malaria cases. So we can see the geographic distribution system. Then we can make specific decision making for that particular area or specific interventions to reduce the number of cases from that area. So it is identified that the number of which place it has more cases and the cause of the disease. And another purpose outbreak detection. If there any sudden increase of increasing of the any cases, maybe the COVID. Now all of us working on the COVID whole healthcare system is working on the COVID response. So we are continuously watching the number of COVID cases in the whole country or whole districts. We see the sudden increase of COVID cases in one district. It's called outbreaks. So we can see that the number of cases in increasing in one district. So we need to give more attention to the districts. We need to make preparedness activities, and we need to give some intervention to reduce the districts in that particular district. So we can say that it is useful for outbreak detection also. The another purpose is that evaluation of interventions. The same example we can discuss that. For malaria, we are giving one interventions, maybe mosquito nets to one district. we can take another district as a control group. So we monitor in the particular time. We can see that one district the number of cases are in the downwards, another district in the same level. So we can see that the interventions, whether it's working or not, we can evaluate that interventions. The next step is generating the hypothesis and stimulate the research. The surveillance data, it gives a lot of information, so we can generate a hypothesis. Same example, if one intervention is working or not, why that intervention is working, why the disease burden is high in one district, why it's low in another district. So the pathogens of any disease. So we can generate many hypotheses from the surveillance information, surveillance data, and that will stimulate the research. And another thing is observing changes in the agent host factors to assess the potential for future disease. In the same examples, we can see that any changes in the agent and host factors. Malaria means which agent is changing, which agent is more prevalent in which area. We can see that in the changes. And we can change the by health practices, hygienic practices also we can detect in the surveillance data. Based on this surveillance information, next we can facilitate the planning. So one district has more number of cases are very high, so we can make any separate plan for the districts, or one state has more cases, we can make separate plans for that. So basically that surveillance data used for planning also. So these are the common uses of surveillance. So we can estimate the burden of diseases, we can see the trends of the diseases, we can analyze the geographical distribution. It may be used for outbreak detection also, and it used evaluation the interventions. We can generate hypothesis from the surveillance and the research. And is there any changes in the agent and the host? And is there any changes in the health practices and for planning? So example of that uses, this is a just a burden. You can see that hospital-based surveillance of rotavirus in India 2005 to 2007. We can see the burden of the cities, burden of rotavirus disease in the cities. The data collected from Impal, Pune, Mumbai, Vellore, Delhi and Trichy, and we can see that individuals with the sample that tested positive for rotavirus is around more than 30%. So we can see the burden of disease from the surveillance data. On the same malaria example, we can see the trends here actually. The data collected from 2000 to 2004. Incidents for 1 lakh cases. We can see the type of malaria, malaria falciparum malaria. We can see that from 2000 it's a peak in 2003 and again reducing the 2004. So we can see that the trend of the diseases over the time by using the surveillance data. The geographic distribution of the disease. So we can see that the places, the location where the number of cases are very high. We can see that forest areas more number of cases than the plain areas, even the river areas have some more number of cases. So we can plan our interventions based on this geographical distribution of this data. Another one is outbreak detection. We see that we also discussed that this data used for outbreak detection also. We can see that from 98 to 2002 there are so many outbreaks, and like fish and seafood outbreaks and bagged potatoes outbreaks and chili size or foodborne outbreaks. We can see that this data, surveillance data, used to detect the epidemic outbreaks of the any diseases and evaluate the interventions. You can see the data from 80 to 88. After implementation of the immunization program, we can see the downwards trends of the diseases. And planning as we discussed in the uses of surveillance slides, this data, that the surveillance data used to facilitate the planning. So we can see the data from 80 to 92, the disease data, HIV infection data, heart disease, cancer, suicide and liver disease data. We can see that almost all the diseases are in the same level from 80 to 92 to heart rate or cancer, homicide, almost all similar. Maybe the unintentional injury is slowly reducing from 80 to 92, but that the HIV data HIV infection from 80 to 92. So you can see that upward trends. It's from a rate of 0 to up to 60 level. So we need to make planning. We need to prepare a plan for that HIV, because its trend is very high compared to any other diseases. So from this session, we know what is surveillance as a systematic data collection. It's a collection, transmission of data, analysis of data, generating the feedbacks, and decision making. And we have seen that all the components of data, key elements from healthcare system and authority, those who analyze the data and generate the feedback. And we also seen that's a cyclical process. We also see that what kind of event data we're collecting. It's maybe diseases, it may be the environmental factors, it's maybe the behavioral patterns, it's maybe syndromic. We also see that two major type of surveillance system. It's active and passive surveillance system. Passive system is a routine healthcare system like IDSP. An active system used during outbreak times like a COVID-19. Actively, healthcare workers seek the data from facilities. And we also the type of reporting system. It may be mail or electronic based, or voice or paper based. And we see that the general use of any surveillance data like disease burden, trends, geographical distribution of the diseases used to detect the outbreaks and facilitate the plans. So in the end slide, we see that what are the key messages from these sessions. The surveillance is a lively line of communication that works in the both way. It's used to direct for decision making, because that routinely collect the events information from the community or the facilities. So it used directly for a decision making. And active surveillance allows detecting more cases at an increased cost. Even though that active surveillance, it needs more the cost and human resources, but it used to detect the more number of cases during the outbreak times like a COVID or SARS time. Individual reporting allows more analysis, but is really difficult to handle. And the data can be analyzed at any level. It may be analyzed at a district level or state level or country headquarters level, but it can be analyzed in all the levels. So thank you for all the slides and all the participants for actively listening.